also have a speaker from the government, if I say so. We have Urvashi Prasad, Director, Office of VC NITI Aayog. We know how important role being played by NITI Aayog. So I request her to share her experience or health tech, enabling healthcare with technology. Over to you.
Thank you, and I've been listening to all the speakers who have had such incredible insights to share on the health tech innovation and digital ecosystem that is being developed in India. I think I'll just highlight a few macro level issues or trends because, you know, as mentioned, I work at the NITI Aayog. We are the policy think tank of the government. And so we do look at these macro trends or issues very carefully and regularly. And where does technology really fit into each of these? Where does innovation, digital innovation in particular, fit in? So I think one very important trend that we are seeing the Indian health system go through is a shift from curative to preventive and a focus on wellness. So we are now talking a lot more about prevention, about public health, about wellness. And I think that is a trend that we have really seen pick up in the last few years. And also post-COVID, I think even amongst the citizens at large, there is a greater realization that, you know, healthcare doesn't mean cure alone. It doesn't mean hospital-based care alone. So I think that is one big macro level trend that we are seeing. And so how does technology really help us to make that shift, you know, from curative to preventive and, you know, promotive and wellness? And I think there one very important shift is that people are now becoming more conscious about their health. And so how can technology really help people to keep better track of their health and fitness and wellness? So I think that is, you know, a big scope for technology and a big role that technology can play in our health system in really helping us make this shift. Also, healthcare is now moving out of hospitals. You know, it's moving from hospitals to clinics to the home and ultimately to the individual. So in all of this, technology has a very big role to play because, you know, once we take healthcare away from hospitals, we take it away from a doctor-centric approach. You know, obviously still doctors, specialists are still critical. They are still a backbone of the health system and you still cannot do without them. But we're also looking at other types of, you know, care which can be provided in other settings now. And the home has become a very important setting and then finally the individual. So I think technology has a big role to play in all of these, you know, sort of shifts that we are making. The second big trend that, you know, we are seeing is a demographic transition in the country. We are still a country of young people. We still have the demographic dividend, you know, to reap, and we will have that for, you know, many more years to come. But also our population of senior citizens is going up. And that too will have important implications for how we design our health system, how we think about innovations, because we do need to cater to this population of senior citizens much better. In fact, there are some states in India where to a great extent this transition has already happened. You know, there's a large and substantial population of senior citizens. And with the fertility rates stabilizing in the country, we're going to only see this happening more. So how do we address this demographic transition from a health system preparedness, innovation perspective is also something, you know, that is high on the agenda now. The next big sort of trend, which you know most of us are aware of, is of course the NCDs, the non-communicable diseases, and we are battling with a rising burden of non-communicable diseases, whether it's cancer, whether it's heart disease, diabetes, mental health issues. And again, here, a lot of these are chronic conditions. A lot of these are conditions that people need to live with for many years or even their entire lives. And what role can technology play in helping people, helping health providers keep a better track of how a particular individual is doing, somebody who is living with a chronic condition, how they are doing. There's a huge role for technology. There's a huge role for, especially something like Internet of Things. In fact, there are other countries, we heard about Sweden's experience, but even closer home, countries like Malaysia, many others, they are actually using Internet of Things. They are using digital technologies to create, smart sensors, to create wearables, to create, monitoring devices, advanced, sophisticated imaging devices, because we need all of this now. When we have to deal with this huge burden of NCDs, we need to equip ourselves, with all these tools. Then I think the human resources aspect, and I do want to touch upon that because, I mentioned doctors and specialists, and, we often say that, there is a shortage of doctors and specialists in our health system. There is an inequitable distribution, and that is true. And of course, the government is working on many reforms to address that. But we are also trying to create other cadres of health professionals, who can work at the primary healthcare level especially. And so we also need to see how technology can equip these cadres. Many of you would be knowing that the government has set up health and wellness centers under the Ayushman Bharat program. And we don't envisage that, you would have a doctor at these centers, right? You would have a primary healthcare team. And how can technology really help that team to deliver on elements like screening for NCDs, creating awareness, ensuring that there's better referral, from the primary care level to further levels of care. So there's technology at a hospital level, at an imaging level, diagnostic level, and also at a primary healthcare level. How can technology, how can innovation, help us there? So that is another piece. Also, a big issue for us, in the policy space is going beyond the urban areas. A lot of times, also when we talk of technology, we talk of, digitization. Historically, it has been something which has been, something which you experience only in the large urban centers. That is changing. Now we have seen, and even during COVID, even something like telemedicine, it's even reaching, smaller towns, smaller cities, even rural and remote areas. So that is the big shift that we are seeing. And we need to push more in that direction, because we do need to take technology and the benefits of technology to all parts of our country and make sure that the digital divide, which we often talk about or witness, is not a reality for us. So that is, I think, a big issue as well. And finally, I would just highlight the whole medtech sector, because, medical devices, pharma, huge innovation, that we saw even during COVID, extensive use of technology, right from cleaning, disinfection robots in hospitals to, remote ICUs, tremendous, amount of innovation that we saw. But we need to keep that up in the post-COVID era. We need to bring in the private sector, as was highlighted by the previous speaker, that in India, still when we talk of research, bulk of the funding comes from the government. And yes, while we say that the government needs to further step up, funding on research, we also need the private sector to come in a much bigger way. So I think that is definitely one factor, but we also need to acknowledge the role that international collaboration plays in that. And this, given that this is India's G20 presidency year, we are raising these issues, through the health working groups. And it's really important that we have, cross-border collaboration on innovation, on research, on data for research, because, the pandemic was not the last crisis, that the world is going to face. And we anyway face a lot of health issues on an ongoing basis. If we look at something like TB, it is very much an ongoing epidemic in many parts of the world. So we need this kind of collaboration that we saw during the COVID era, in digital innovation, in technologies, in data, to also extend beyond. And hopefully we will achieve some of this through our G20 presidency. So I'll stop here. Thank you very much for inviting me, and it's really a pleasure to be here. Thank you.
Thank you, Urvashi Prasad, Director, Office of VC NITI Aayog. As you have rightly said, taking cue from what you have said,